Hello everyone, my name is Drayton Armstrong. I am the Chief Informatics Officer at our company, and I'm here today to propose some fun, interactive learning with wound care. I won't take up too much time, so I'll just get right into it. Let's begin with outlining our SMART, SMART Learning Objectives. The first objective is specific. We want to teach healthcare staff how to identify and apply appropriate wound care techniques. To measure the success, participants must demonstrate proper cleaning and dressing skills in 90% of simulations or score at least 80% on Kahoot quizzes. These goals are achieved through interactive tools like Body Interact, which is a virtual patient simulator, or Kahoot, which is an interactive quizzing platform. This training is relevant because better wound care directly improves patient outcomes like faster healing and fewer complications. Lastly, the program will be completed within 2 months. On this slide, I am highlighting the two main methods of teaching for our wound care training. Virtual patient simulations provide hands-on practice with real-world wound care scenarios. This is in a safe and controlled virtual environment. These simulations allow participants to apply their skills without risk to patients. Additionally, interactive quizzes with Kahoot engage participants by testing their knowledge in a fun and competitive way. Kahoot can also allow us to upload photos, which can help staff visually identify and differentiate wound types. Here, I've outlined our resources and support. Available resources include experts in wound care such as wound care nurses, specialists, and infectious disease doctors. They can provide valuable insights and guidance to our staff. Existing wound management protocols will also serve as a foundation for training. Needed resources include the Body Interact simulation software for hands-on practice, a Kahoot subscription for interactive quizzes, and funding to cover training materials and tools. These resources will ensure an engaging and effective educational experience. This is my proposed timeline. In weeks 1 and 2, we will focus on purchasing and setting up the wound care simulation software, as well as creating the Kahoot quizzes. During week 3, we'll train instructors and IT staff on how to use both the VR patient simulator and the Kahoot platform, followed by a small pilot test to ensure everything runs smoothly. Weeks 4 through 6, we will see the VR training program rolled out to staff, with 3 to 2 sessions per week depending on staff attendance and pre and post Kahoot quizzes included in each session. In weeks 7 and 8, we will gather feedback through surveys and assess understanding based on performance in the post-training Kahoot quizzes. This structured timeline will ensure the program is effective and runs efficiently. For our plan of action, we will announce this training through emails, posters in staff lounges, and at all staff meetings to ensure everyone is informed. Staff will be able to confirm their participation with a Google Calendar. In case of any VR simulation equipment malfunction, we will have a backup plan in place. We will use videos or hands-on practice with mannequins to continue the training without disruptions. To evaluate how well this whole rollout worked, we will use pre- and post-training Kahoot quizzes to assess participants' knowledge before and after the training. This will allow us to measure improvement. Additionally, we will monitor infection rates and wound healing outcomes over the next 6 months to evaluate the long-term impact of the training. Finally, we will conduct participant surveys to gather feedback on their training experience, helping us understand how well the program is working and where we might be able to improve. This data will guide future adjustments and enhancements. Thank you so much for listening. If you guys have any questions, you can reach out, or if you want any further clarification, I'd be happy to give it. I hope that we can roll this out because our patients deserve proper wound care. Thank you so much.